So, hello parents. Today I'm going to tell you about autism. What is autism? Its early signs and what parents can do for their children. So, autism is a spectrum disorder which affects the overall physical, social, and emotional development of a child. It's a neurodevelopment disorder. It can affect differently to each individual. It can be best treated through therapies only. And these are the some of the red flags, early signs of autism that if you observe at home between 9 to 18 months of the age of your child, so you can see these things if your child is not giving eye contact. Another one is if your child is not responding on his name or her name, if your child is self absorbed, means the child wants to play alone, stay alone, and is not interacting with the family members. And fourth is if your child has some repetitive kind of behaviors, that something that he or she is repeating, clapping or looking at some place or running or not sitting, restless. And fifth one is obsessive interests. It means that if your child has some interest that he wants to do again and again, again and again, same thing, and you feel that this is an obsession. So if you see that these kind of things, and if you see that your child has difficulty in social interaction, he or she is not happy while some adult or some children wants to interact with your child, and not smiling, and not want to doesn't want to play with the other children, and doesn't want to interact with adults. So these are some of the early signs or symptoms where we can uh, think or guess that at home that we should go and show to the doctor if we are observing these kinds of signs. So what should we do? You should show to a doctor immediately, because early diagnosis can help a child in getting early intervention. Early intervention is a program where therapists, educators, they help children in bridging the gap, and a child can achieve further milestones easily. If you are going for regular intervention, regular early intervention services, early intervention therapies, so that's why I'm saying you should show to a doctor, because doctor will be able to send you to different therapists and different other doctors, whichever is required for your child. And you will get an early diagnosis, and if you have an early diagnosis, you will be able to do work with your child, and you can choose early intervention between 2 to 5 years of age. And early intervention always helps. It bridges the gap. Early intervention bridges the gap, and the child can achieve further milestones easily. So go for the diagnosis, go to the doctor to consult always. And don't think that you can go to a doctor once your child will be 4 or 5 years old. Don't think this thing, because 2 to 5 years is the right age of early intervention, and it is easier to cover the gap if you are going early to the doctor. So don't wait for the age that and sometimes I have seen that the parents are saying, my husband started speaking late, or my child's great grandfather started speaking at 8 years of age. So don't go on these things. You must go to the doctor and take early diagnosis. Now, Don't be anxious. I know that this is very, very hard when you get a diagnosis of autism, but don't be anxious. There is a treatment of everything. Make yourself strong and give more power to yourself. Children with autism diagnosed at the right age and undergone regular therapies, and if their parents are also helping at home, you know, they are doing very well in their life and working with very, very good companies. This is my experience because I have given therapy to those children, those were diagnosed at the right age and taken therapies regularly, and parents had given did generalization, and parents worked at home, they helped at home. They are really doing well in their lives, so don't worry, don't be anxious, start working. Okay. And so there are some parents who are always asking, my child is not speaking, it means autism. So I'm saying not always. If your child is listening to you, following your commands, understanding whatever you are saying, understanding the language, and expressing non verbally through signs, gestures, or pointing and giving eye contact. So, this could be only speech delay. In this case, also, you must consult your doctor. Doctor may refer you to the right therapist. So, if your child has only speech delay, doctor may refer you to a speech therapist. And if there is something else, doctor will be guiding you. And this is important, how parents can help their child at home, whether they get the diagnosis or not get the diagnosis, or uh, this is for the parents who have children between 0 to 2 years old, and they can prevent through the activities by interacting with their child. They can prevent learning gaps. I'm not saying autism, or I'm not saying any other thing, but I'm saying, yeah, learning gaps will not be seen in the children whose parents are stimulating their child. So, stimulate your child by the following activities. These are some of the activities. There are tons of activities we can do at home with children, but these are some of the activities. So, the first is play by making different sounds. You can play by dog sound, make a dog sound with your child and ask your child to repeat, or car sound, aeroplane sound, cat sound. So you can play by making different sounds. Tickle your child and make your child laugh, because laughing is also when your child laugh and laugh out loudly. Your your child is using speech. So tickle your child and make laugh, because when children laugh, they sometimes say sounds and words suddenly. Sing lullabies and rhymes to your children. uh, Children learn new words, vocabulary, and music. They listen to the music and get calmed down, and they learn new words through the rhymes and through and read stories. Reading stories always a very good way to develop vocabulary and sentences, and cognitive level also goes up when you read a story to your child every day. So play with the age appropriate toys and give time to your child. If you are giving time to your child, interacting your child on a daily basis, and to stimulating your child, so definitely your child will become really a smart child, and learning will be faster of those children I have observed when parents are interacting with them. And after getting a diagnosis, these are some of the pointers that you can that you can remember, you must remember, and you can use these things. Like, first one is, do not run behind academics in lots of classes, because I've seen parents fix their classes one after the other. They doesn't give them time to play, they doesn't give them time to interact with the family members. Those children I have seen, they have back to back classes, and some education class, ABA class, speech, OT, and other classes, yoga, and many classes. So these are not going to help your child in this way, because in this way your child is getting super tired, and the processing is not happening with what he has done, and you may not receive the desired results. And you have to work on emotional regulation by playing and following the lead of your child. Okay, so whatever your child wants, do that, play in the way, and obviously give quality time, and start therapies. Keep on therapies for 6 months to 1 year, so the child can learn the skills. Because I've seen some parents, they start therapies and thinking that their child will achieve the expression and verbal expression, everything the child will achieve in 1 month or 2 months. See, this is not a medicine, this is not an antibiotic. So you have to keep your child on therapies for quite some time, and you have to be regular for that. Regular and consistency helps a lot. If you're not regular, you are taking on and off therapies, you are breaking therapy sessions schedules, you will not get good results. And see, if you are taking therapies, if you have to take therapies, you, and I'm saying you must take therapies when, if you have a diagnosis and you see that there is a need of therapies, you must keep it regular basis. Consistency is the key to get desired results, because many parents skip therapies, they take breaks from the therapies. This is not going to be a long time. Yes, it is long time, but not too long if you are regular on the therapy. If you're regular for first 1 year, you can minimize the session in the second year, you can take more less sessions in third year, and then gradually you will be your child will be out of the therapies. So remember to be regular and consistent for therapy sessions. And another thing, you start play school after therapy is done for 6 months to 1 year. Don't be in a hurry that my child will go to play school and learn some social skills also. I know that your child requires social skill, but what happen when your child go there and your child is not able to tell that I want to go to the washroom, and your child is not sitting at one place, and teacher is obviously looking at the 30 children or 20 children or 15 children, and your child will be leave with some nanny, and your child is not enjoying at all. So don't run behind the play school immediately after getting a diagnosis. First work on one-on-one therapy sessions, and at home you must give them, generalize whatever done in the therapy classes, follow long-term and short-term goals, make your own plan for home activities, and keep park timings, outing, family meets with your child. Do not keep your child away from social gatherings, because that is a learning. Social gatherings, social skills your child can learn through family and family members also. So now these are some of the communication ideas for kids at home, that do babbling. Because if your child is not doing babbling is the chaining of sounds, ba 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 ba, da 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 da. So do babbling, copy sounds that your child is making, and so this is the way to teach imitation skills also. If you're copying the same sounds, you're copying the same actions of your child, so your child is learning to imitate. Do parallel talk. Follow your child's lead to boost his confidence and teach facial expressions to your child, because facial expressions, like someone is angry, someone is happy, when you are sad, when you are happy, what is the happy face, sad face. Don't teach it with the pictures. Make your face in front of the mirror and teach your child when you are happy, when you are angry, show your angry face, so that your child learn to notice the facial expression of others. Okay, and sit face to face to develop eye contact. Okay, so if you're sitting face to face and one on one, then your child definitely look into your eyes. There are certain activities of eye contact. I will give that to you so that you can develop eye contact at home. And always start any activity with the interest of your child. Don't push your child to do the thing that he doesn't like. All right. So another thing is, teach animal sounds before teaching words. Animal sounds, I'm saying it because if I say teach sounds before teaching words, so what sounds? So sounds can be taught by animal sounds, like dog barks bow bow. The burr sound is coming, bow 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 bow, and cat says meow ma ma meow. Mer sound, your child is learning mer sound and learning cat. Cat says meow, and this is a very interactive activity for children. When they are playing with the animals and making sounds. Do many activities while playing with the animals and animal sounds. Show pictures of family members and tell names of family members so that they will be aware of their family members, uh, and their names. Teach names of daily use objects, kitchen things, bathroom things, school objects, bedroom objects. So, and then teach action words like eating, drinking, sleeping. Okay. And you can let us know if you need any help. Another thing, if you find your child has behavior issues, he may cries a lot or hitting anyone, or there are many other behaviors or one of the behavior, you have to find out the reason of problem behavior and help your child. Because if you know why your child is crying, if he's if he or she's crying because of hunger, because of thirst, because he may wants to go to the washroom, he may wants to go out, or some uh, cloth that he is wearing is not comfortable for him. Sometimes shoes are not comfortable, tight or loose socks are not comfortable, um, and many other things. There are many other things. You have to find out the reason of problem behavior and help your child. Sometimes your child may not slept for the night, that's why the child is crying. So you should know that your child didn't sleep, and that's why the behaviors are coming. So you have to learn, to check the behaviors, to check the reasons behind the behaviors. So if you if you know the behavior reason of the behavior, you may help your child before triggering the behavior. All right. And then how to manage the behavior. There are many activities, few of them I'm telling you, that by using picture boards, picture apps, AAC. AAC is alternative augmentative communication. So you can use pictures to point, so children can express their needs. For example, if the child is hungry, you know the child is hungry, but you don't know what your child would like to eat. So you can show picture of his favorite snack. If this is a snack time, you can show picture of favorite five snacks or two snacks, and ask your child, what do you want? And the child may point to on one of them. So you should have that um, eatable present at that time, and you may immediately give that eatable to your child, so that he will learn how to point and what he will be getting after pointing, and you can model them also. Teach them gestures, signs, and ways to help themselves. You can start a speech language therapy if your child is not non-verbal. You can take for occupational therapy, sensory integration therapy, because if there are sensory needs, children are not able to tell you what is happening inside their body, and they may need sensory integration therapy. And try to understand your child so that you can handle behavior at home. You can check other videos of behaviors handling how to handle at home. Do not compare your child with other children, because each child is different and improvement speed is different for every child. They may learn through different techniques. Do not get demotivated by talking to other parents if their child is taking time in getting in improving. Maybe your child achieve goals faster, so don't get motivated. And talk to the parents whose children got overcome from autism, because you will get motivation and you can learn from them how did they work with their child. Okay, so stay positive and achieve one small goal every day for your child. You will find yourself on the winners page one day, I'm sure. Thank you.